Could you imagine being on continuous dialysis for 24 plus hours? Stay tuned for CRRT Must Knows. Hi guys, welcome back to the Mama Nurse channel where we discuss everything nursing, motherhood, and lifestyle. I'm Vanessa. Please subscribe to the channel and make sure you hit that notification bell so you can be notified every time I drop a new video. Make sure you guys check the description box. I always have links for different tools that I use and different things that might be useful for you as a nurse or you as a mom. So make sure you stop by the description box before you leave. So CRRT is Continuous Renal Replacement Therapy. It's something that we use often on our ICU unit. It is typically a one-on-one assignment because you're doing hourly I's and O's, hourly calculations and adjustments when it comes to your CRRT machine. There is a class that is required of you to take prior to being able to manage or have a patient on CRRT. CRRT is a blood purification therapy that's used for patients who are experiencing an acute kidney injury. During this therapy, the patient's blood passes through a special filter that purifies, that removes fluid and uremic toxins and returns clean blood to the body. So some of the advantages of CRRT as opposed to hemodialysis is CRRT is a continuous therapy. So you will not be disconnected from the machine unless the filter is being changed. With hemodialysis, it's typically done every other day on schedules of either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. They do adjust those schedules from time to time. And once you're starting out with hemodialysis, typically you will have consecutive days of your treatment until they get your body in a better state. And then they would switch to that scheduled dialysis. So with CRRT, you have greater hemodynamic stability. There's avoidance of rapid fluid and electrolyte shifts, and it is adapted to the needs of the critically ill, hence why we use it in the ICU. So now we're getting into the must-knows. As a registered nurse working with a CRRT machine or a patient going through CRRT therapy, there are certain things that you need to know. I can't go through everything because it would be easier if I had the actual machine to show you some things, but I'll give you a brief rundown of some things that will help you out in the future if you need to set up a CRRT machine. So must know number one, when you set up your machine for the initial setup, you must set your date and time. This is crucial. When you are doing your hourly I's and O's and your hourly patient history programming, it will make more sense once you're working with the actual CRRT machine, but you're doing this every hour. And the hour that you pull up on your screen is the hour that you would document on your documentation for your records or the patient's records. So you want these times to match up. Otherwise, you're going to be looking at a screen that says 4 a.m., but it's really 9 a.m. And then you'll have to do those calculations every hour. Just makes things too confusing when you have all these other numbers that you're working with. You want your times to be set and on point. That way you don't have any confusion in the future. Must know number two, you will need to document everything that goes into your patient and everything that comes out of your patient. So this includes clearing out every IV pump, which typically when patients are on CRRT, they have at least 6 to 10 pumps, IV pumps, if not more. You will need to clear out every pump every hour. You need to check your Foley or urine output. Typically, the patient will have a DigniShield or some type of rectal bag. You will need to document that output. If they have an OG, document that output as well. Any flushes that you put into the patient, any saline flushes, document that. If you're removing blood, if you're giving medications, all of these amounts need to be documented accurately because this is going to help you figure out how much fluid you need to remove for the next hour. So that kind of went into must know number three. It's basically that you're doing your calculations every hour, so you need to make sure that they are accurate because it does correlate for how much fluid you need to remove from hour to hour. Must know number 4, you will need to prime your filter set prior to connecting your patient to the CRRT machine. This is done using 2-liter bags of normal saline, so make sure that you have those ready to go once you do your setup of the machine, or if you're in the middle of a treatment and you need to switch out your filter. So must know number 5, if your filter is clogging, you can return your blood to your patient and then change out your filter. If your filter is clotting, then you must stop the treatment, remove the setup, and change out your filter without returning that blood back to the patient. So this is crucial. If your filter is clotting, you don't know where these clots are, how big they are, how small they are. So you do not want to return that blood back to the patient. If there's just a clog, then you can return the blood back to the patient. Now, this does make a difference because obviously all of that blood that's in that filter set is going to be lost. So your patient can now potentially be hemodynamically unstable. You want to try to work ahead of the machine. If you notice that your numbers are rising, then you would want to adjust and switch out your filters before it becomes a situation where you're racing against the clock. So if you're a current nurse who works with a CRRT machine, let me know down in the comments if you guys have it as a one-on-one assignment. I have heard from different facilities that it is not a one-on-one assignment, but at our facility it is, which I'm thankful for because it is a lot of work. You're doing a lot of calculations every hour. You're changing out the dialysate bags every couple hours, give or take, just depending on how much fluid is removed from the patient. You're switching out your waste bag at least every 2 hours. Plus, you're managing all of your drips that the patient is on and making sure that the patient is stable. So a lot of work goes into it. The class that you have to take is at least 4 hours, and you do have to make sure that you're competent in it. It is scary at first, but once you get your first CRRT patient and you get the flow of how to do your numbers and everything like that, then it all just makes sense and it's much easier. I do have a flow sheet that I use for my documentation when it comes to having CRRT patients that keeps me organized for my hourly I's and O's and my hourly numbers for the CRRT machine. So I hope this information was helpful for you guys. Hopefully it gave you some good tips on starting a CRRT machine and all of the must-knows. So until next time, stay safe, be well, and live life.